Oh, yeah.
Back door here?
Oh,
So they're not.
I love it. Now I love it better.
Senate will come to order. We'll have a moment of silence in lieu of a devotional. Thank you. Good afternoon.
Good afternoon.
Are there any announcements? Seeing none, we have a House bill for reference, H 952, introduced by the Committee on Corrections and Institutions, an act relating to capital construction and state bonding budget adjustment. Please listen to the first reading of the bill.
H 952, an act relating to capital construction and state bonding budget adjustment.
Now you've heard the first reading of the bill. It is referred to the Committee on Institutions. That brings us to the orders of the day. We have up for third reading H 237, an act relating to prescribing by doctoral level psychologists. Are there any amendments to be offered prior to third reading? Senator from Franklin.
Thank you, Mr. President. Being handed out today is a proposed amendment to this particular bill that is being offered. The amendment goes to the issue of the age cutoff in the underlying bill. And the age cutoff of the underlying bill essentially does not allow psychologists to provide treatment, as the bill is designed to do, for anyone who is over the age of 80. There are issues, I believe, that are significant with this cutoff, in particular because there are more than one federal law that prohibits it. Essentially, that says that you cannot make medical determinations on the basis of age, even though Medicare does by the 65-year-old cutoff. But it says that a provider can't do that. And this particular bill does that. What the amendment does is it simply says that for people who fall into that category, there is a way to do that. And if doing the cutoff is based upon an examination, is based upon medical facts, is based on certain comorbidities, based on certain prescriptions that that person takes, then it is appropriate to use age as one of the factors to make a decision. But it can't be used exclusively any more than you can say that a physician cannot treat a person because of their race, because of their sexual orientation, or because any one of the other protected categories. And age is a protected category in that situation. And so what this does is it simply says that, at least as far as the person over 80 is concerned, that instead of an absolute blank requirement, it says that a prescriptive authority excludes the authority to, in 17B, prescribe or discontinue prescription drugs for patients who are, it says, are less than 18 or are pregnant. And less than 18 basis, of course, is their juvenile. They're not authorized, that they can't make those independent decisions, or who is pregnant, because that, again, is a medical condition that is relevant to the diagnosis. It then, though, goes on to say that there's a new sentence added. It says the written collaborative agreement, which is between the psychiatrist and the psychologist, shall contain a protocol for the completion of a clinical risk assessment of each new patient prior to treatment that specifically includes a review of prescription drug interactions and physiological considerations. What that does is it allows for a diagnostic reason to be used for treating elderly patients or patients of advanced age, because very often those people are affected by the kind of treatment. They may be affected by a drug that's prescribed. They may have a condition that is much more likely to be true in an older person than in a younger person. It requires that. This doesn't specify what kind of review, what kind of interaction, what kind of clinical review is required. That's left to the two prescribers to do, or to the extent that there's regulation, the Office of Professional Regulation, if it chooses to intervene, but it doesn't require them, it doesn't make them. But this is designed to provide a degree of protection to all of the people involved so that you don't do something that is patently against federal law, at least based on the research that I've done. There are a number of other states that allow prescribers to be psychologists. Generally speaking, they also involve a psychiatrist or other medical provider providing some degree of oversight or involvement in various state-by-state basis. But at least of the research that I've done, and I can't say that I've looked at every section of every law that affects this, I could not find a single case that did a specific age cutoff as this legislation proposes to do. Thank you, Mr. President.
Thank you, Senator. Question is, Senior Senator from Chittenden Southeast.
Thank you, Mr. President. We know that this bill has been sitting on the calendar for a while. It also has been in, as the senator from Chittenden Central reported yesterday, it has been in Senate Health and Welfare since last year, May, I think. And your Senate Health and Welfare Committee did consider many issues related to the permission that's been given to psychologists to prescribe for their patients. And as part of that discussion, we are concerned about elderly patients who are some of the most vulnerable to increased numbers of drugs. Elderly patients are known to have polypharmacy, which means they take more than one drug. And many of those drugs may be related to psychotropic drugs. And we know that as folks get older, there are physiological changes with reduced liver and kidney function. There are changes to brain vulnerability. In other words, drugs cross the blood-brain barrier in a more expeditious manner. So those things need to be taken into consideration whenever anyone is treating an elderly patient. So, Mr. President, in many ways, what we have in the bill as passed by your Health and Welfare Committee is more protection and more care for elderly patients as they do become more vulnerable as they get older. So, and I don't want to prolong the conversation regarding the medical foundation for this, but just knowing that if someone has two medications, they are at an adverse drug reaction risk of increase of 13%. If they have 5 medications, which is not unusual for someone who's elderly, to have a 58% adverse drug reaction or risk. So there is data that supports providing greater care for people as they get older and having consideration for the prescribing authority that is given to the psychologists in the bill. So, Mr. President, that is on that particular section of the bill. In the other section of the proposed amendment, the second proposal amendment really dives into what the professional relationship would be with the practicing psychiatrists and practicing psychologists. And we did hear from the Office of Professional Regulation that these protocols are established on a regular basis, and to have it in statute is extremely unusual. So we would, on a majority vote or straw vote on the part of your Committee on Health and Welfare, we ask that you not support this proposal of amendment. Thank you, Mr. President.
Thank you, Senator. Question is, shall the bill be amended as proposed by Senators Brock and Chittenden? Are you ready for that question? All those in favor signify by saying aye. Aye. All those opposed, nay.
Nay.
The nays appear to have it. The nays do have it. And you have not, sorry?
Division?
Division has been requested. All those in favor, please stand. All those, please be seated. Thought that was implied, but all those opposed, please stand. Please be seated. I can't. Okay. Please listen to the results of your vote. Those in favor, 11. Those opposed, 15. And you have not amended the bill. Are there any other amendments prior to third reading? If not, the question is, please listen to the third reading of the bill.
H 237, an act relating to prescribing by doctoral level psychologists.
You've heard the third reading of the bill. The question now is, shall the bill pass in concurrence? Are you ready for that question? If so, all those in favor signify by saying aye. Aye. All those opposed, nay. Nay. The ayes appear to have it. The ayes do have it, and you have passed H 237. We now have up for third reading H 733. Are there any amendments to be offered prior to third reading? Seeing none, please listen to the third reading of the bill.
H 733, an act relating to designating a franchise relationship.
Question now is, shall the bill pass in concurrence? Are you ready for that question? If so, all those in favor signify by saying aye. Aye. All those opposed, nay. No. The ayes appear to have it. The ayes do have it, and you have passed H 733. That completes the orders of the day. I would look to the senior senator from Chittenden Southeast for a motion.
Thank you, Mr. President. I move pending announcements that the Senate stand at adjournment until 11:30 on Friday, April 10th. Thank you, Mr. President.
Are there any further announcements? Senator from Windsor.
Thank you to all of those who stopped by the Climate Solutions Caucus today for lunch. The demonstration of how our electric grid works in a hands-on way is still available until 2 p.m. So if you'd like to see it, you can still go see if an LED or a incandescent bulb, for example, takes more energy until 2 in room 10.
Any further announcements? Senator from Washington.
Thank you. Senate appropriations to meet at 1:30.
Senator from Rutland.
Senate Government Operations will meet at 2.
Ethics. Ethics training. Oh, yeah. Oh, we're doing it.
Senate Secretary reminds me that we have a decorum session until 2. So with that said, Chair of Appropriations, would you like to amend your announcement?
Thank you. I'd like to amend my announcement. We will meet after the session decorum.
Thank you. Are there any other announcements? Senator from Washington.
Thank you, Mr. President. Senate Finance will meet at 2.
Any further announcements? Senator from Windsor.
Thank you, Mr. President. We had a terrific final Farmers Night, and it occurs to me that even though, and I would also like to express deep appreciation for the one senator who did join us at the Braver Angels workshop, which was, I think, very useful as we work to reduce the divides and improve our conversations with people we disagree with. It just was terrific. I would like, however, to ask all of you, even if you don't necessarily come to Farmers Night on a regular basis, if you have performers in your neck of the woods who you think we ought to be including in Farmers Night next year. We'll begin that process in June after session, and I'd appreciate hearing from you. So thank you very much.
Any further announcements? Seeing none, I will ask only that senators remain seated once we gavel out, and we'll move into the decorum session that was just mentioned. With that said, Senior Senator from Chittenden Southeast has moved that the Senate stand in adjournment until 11:30 a.m. Friday, April 10th, 2026. Are you ready for that question? If so, all those in favor signify by saying aye. Aye. All those opposed, nay. The ayes have it, and we stand in adjournment until 11:30 a.m. Friday, April 10th.